So what are cataract surgery risks? Cataract surgery is one of the safest operations available, but however commonly performed the operation is, even in experienced hands, there can be certain complications that occur, and these would need to be addressed with the experience of a consultant ideally. Now, the commonest complication is actually something that develops after surgery. The thin capsule that is initially transparent and holds your artificial lens in place can start to become cloudy with time. It can happen as early as a few months into the surgery or even 5 to 10 years after surgery. And this is what some people refer to as a second cataract. It causes a gradual mistiness and haziness just like the cataract did. It's very easy to address with a YAG laser procedure. That's a day case and it takes about 5 minutes. The chances of that are about 1 in 20. Other complications that can happen in the order of about 1% include this thin capsule breaking during surgery. In an experienced consultant's hand, that risk is significantly lower. And depending on certain features within your eye, that risk may actually be higher. That's something that will be discussed with each person individually at the time of their consultation before the surgery so that they know what their risks are. The National Cataract Dataset is a large study of all available cataract surgery in the UK, and it has clearly identified factors that increase the risks of posterior capsular rupture. Such factors include an older age group over the age of 80, being male or having difficulty lying flat, being on certain medications such as tamsulosin. Advanced diabetic retinopathy and glaucoma are also risk factors, as are conditions such as pseudoexfoliation. What patients are most afraid of is the risk of going blind. The risk of a blinding complication that can occur if you have a severe infection after the operation or a significant bleed in the eye during the operation is about 1 in 1,000. Those risks are generally safer than crossing most roads in London. There is a very small risk of losing the eye, and that is generally quoted as about 1 in 10,000. It's important to remember that the risk of not taking action from having poor sight is increased falls, is a reduced quality of life, and even a reduced mood. When you are symptomatic from surgery, it is worth taking the risks. When you are not symptomatic, if your life is not affected by cataracts, we don't operate. And that is an individual discussion with each patient based on their needs. One of the reasons patients come to see me in the independent sector is because they want that extra reassurance that their surgery will be performed on their terms, in their time, by an experienced consultant. The NHS deals with cataract surgery extremely well, and most patients have an excellent outcome as a result of their surgery. However, some of my patients feel they want that extra certainty, that extra reassurance that they will be only in the hands of a consultant. And under those circumstances, we will meet their needs as needed.